Hey everybody, I'm Shalia Hartvigsen. I'm the Physician Associate at Ward Institute. Today we're going to be talking about fillers. Filler is a substance that, well, it fills. It's typically a hyaluronic acid-based gel that takes up space in an area to increase the volume. Hyaluronic acid is a naturally occurring substance in our bodies. It's found in the skin and in the joints. It works by attracting over 1,000 times its weight in water. The most popular areas for filler are the lips, the cheeks, the jawline, even though there are lots of other areas that it can be used cosmetically. Although the results of filler are immediate, they are temporary. Your body will naturally degrade the hyaluronic acid in the filler over a series of months. This time frame can be different for every person depending on what type of filler you got, where it was placed, and your own individual metabolism. So you should plan on getting maintenance filler injections for as long as you want to maintain that look or until you're ready for a permanent option. Surgery can offer permanent options, and I'm happy to discuss those options with any of my patients who are ready. Now, what should you be expecting for your filler injection? Well, once we verify that you're a good candidate for filler, I will clean the area and get you as comfortable as possible. This can mean different things for every person. Sometimes one person will need numbing cream, a different person will use ice, another might use numbing injections, or some people don't need any numbing at all. This is pretty common if you're getting filler in the cheeks, which is just generally a less sensitive area. Once you're good and comfortable, we begin the injection. This can be a little bit uncomfortable as the filler expands the area, putting pressure on the surrounding tissues. However, it's probably not nearly as uncomfortable as you're thinking it's going to be. After the injections are complete, you may notice a little bit of swelling or bruising in the area. Swelling and bruising is far more common in the lips than other areas on the face. To help with swelling and bruising, my #1 recommendation is ice. I even send you with a couple ice packs before you go home just to get that process started. If you need to take something for discomfort later on, I recommend Tylenol as opposed to ibuprofen or aspirin, which can cause a little bit more bruising. It's totally normal to feel small lumps or bumps in the injection area afterward. If you notice these or if they bother you, simply massage them. I like you to massage fairly aggressively to help the filler smooth out and integrate with the surrounding tissues better. After a week or two, the swelling and bruising should be pretty much cleared up. At that point, I like you to come back in for a little follow-up visit. At that visit, we'll reevaluate the area, make sure that your symmetry is good and that you have the fullness that you're looking for. If necessary, we can add a little bit extra. A lot of people ask me things like, if I already have a round face, why would I want cheek filler? Wouldn't that just make me look chubbier? Now, that isn't always the case. If you have a good injector who understands proportions of facial anatomy, then getting cheek filler can actually help the face appear more slim. If you have a rounder face like I do, getting cheek filler along the bone can actually create a more pleasing proportion, giving more volume to the upper cheek and less volume to the lower cheek. This creates a better contour, allowing some shadow to hit underneath the cheek and giving the appearance of a slimmer face. This is very similar to what you would do with your contouring makeup, just that it's more long-term. Some patients come to me with questions about filler causing blindness, and they wonder if that's true or not. While tissue necrosis and blindness are inherent risks of any filler that you do, a smart injector will have a lot of things up their sleeve to do in order to mitigate that risk. Make sure that your injector is both qualified and well-trained. While it is important for an injector to be able to do a lot of things with filler, it's even more important that they know what not to do with filler. The vast majority of filler cases that have resulted in blindness have been when injectors were injecting filler in areas that should be avoided. This typically means the glabella, the forehead, or the nose. That's why I only started offering nose filler after I had been extensively trained by a facial plastic surgeon, including spending lots of time with him in the operating room. This is also why I never inject filler into the forehead or the glabella. If you have concerns about any of these things, please discuss them with your injector. I always want my patients to feel comfortable and part of the discussion and decision making for any treatment that they choose to pursue.